Now, we've already started to touch on the Cass review, Dr. Cass. What finally triggered a proper high-quality review, and what do you think its the most important findings have been, just to bring us up to speed on it?
Sure. I think Kira Bell's hearing was a huge part of it, but there were sort of steps. There were campaigners who were trying for years to get the news out whatever way they could. Incredibly, the first whistleblower at the Tavistock was in 2004. A psychiatric nurse who said you can't be giving hormones after 4 appointments. And she was forced out. There have been several whistleblowing episodes. A governor at the Tavistock, David Bell, wrote a very critical report because a whistleblower came to him and said, you know, if you raise any doubts about treatment, you're frozen out. The head of safeguarding suffered severe detriment in her workplace, Sonia Appleby, for raising safeguarding concerns. She won in an employment tribunal. So all these brave people over time chipped away at the idea that this was a black box that you could just put, you know, distressed children into. The clinicians knew what they were doing, and out they'd come magically the opposite sex. And then finally the Cass review was commissioned. It was commissioned 4 years ago, or just a bit short of. 2 years ago it published an interim report, which was already, look, the evidence doesn't look strong. And then the final report came out last week. So what were the highlights? Basically, there is no evidence that puberty blockers help with gender distress in children. There's very little evidence for the use of cross-sex hormones in general. It's obviously true that puberty blockers, which just basically do what they sound like, but they're basically a chemical kosh. It's like going directly into menopause in one day. They just cut off a particular whole set of hormonal interactions in the brain and body. We know that that's going to be bad for you, because it's interrupting an extremely important developmental sprint. It can't be good for you to do that. The question is, how long-term bad is it for you? And the emerging evidence is it is quite long-term bad for you. Your brain and your bones won't recover really. So that's clear. It's also clear that if you progress from taking puberty blockers early in puberty to take cross-sex hormones, you'll be sterile. You probably won't be able to have an orgasm, and you may never discover what your sexuality is because you won't ever have gone through your natural puberty that tells you who you are as an adult. So all of those things are known. But what Cass said was that the evidence for using it to treat gender distress was neither one way or the other. But if you think of the bad things on one side, like the sterility, disrupting a very important developmental moment, you need something very big on the other side to justify it. You need that it really does treat this really horrific feeling very, very well. And that's gone. So now there's no justification for using puberty blockers. There really isn't. There's no promise that it's going to help, no likelihood that it's going to help, and it's very, very risky. So that's the big one, I think. And then just the total, really very poor quality of both the care and the research. And the systematic review that she commissioned from the University of York looked at 103, found 103 relevant papers that fit the criteria. 2 of them were high quality. Now it was 50-something were medium quality, and that's fine. Look, medium quality can just mean they were a bit small, as in not many participants. Lots of studies are medium quality. You combine them, and if you see that they tend to go one way, you actually build up a proper picture of what's happening. And just short of 50 studies were poor quality, and they were discarded, because if you include poor quality things, you're going to get a bad result. So they looked at the rest, and they didn't all point the same way or suggest any clear picture. They were all just very different. And what came out at the end was there's just no evidence base for this treatment pathway. They've been doing it since 2006 or 7 in America, and in quite large numbers globally since. And they've been doing it, full throttle in the Tavistock since 2014, and they've no evidence for it. And just a priori, you would know that interrupting a child's puberty would be a very significant thing to do. And sterilising somebody, sterilising a child, again, it's this diffuse thing. You say to yourself, well, they could come off the puberty blockers and go through their normal puberty, so I'm not sterilising them. But basically nobody does. About 98% of people who go on puberty blockers go on to cross-sex hormones. And then you think, well, they don't have to go on to have the surgery, they could still revert. But at some point, you can't go through your own puberty anymore. We don't exactly know when, but we know there's a window, and it closes. So they are sterilising people, and they're sterilising people at age 10 or 11 when they start them on the puberty blockers with fairly high certainty. And you would only do that, the only situation I can think of that you would do that in is if the child has a cancer that's going to kill them and you refer them for radiotherapy or chemotherapy, knowing it will sterilise them, but it will save their life. So they're doing a treatment pathway that a thing on the other side of the scales would have to be death. And that is why they say the suicide risk is so high. And that's the second important thing that Cass said. She said we can be sure that gender distress does not need puberty blockers to stop suicide. Puberty blockers are an ineffective treatment, a non-effective treatment for suicidality in gender distressed kids. That wasn't the evidence is not in yet. That was the evidence is in, and that's a lie. And it's a lie that the campaigners say all the time. And the reason they say it is because they know they need something really big on this side of the scales when people start looking at what's on this side of the scales.